Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
All right, well, welcome everyone. I'm Lauren. I'm glad to have everyone here today for this great presentation on cancer and illness, intimacy, body image, and sexual wellness. Today, Jen Fetcher is our presenter. We're so glad to have her. And Jen, I'm turning it over to you now.
All right, thanks so much, Lauren. And thank you guys for having me today to cover these very important yet very under-discussed topics. So like she said, this is kind of an introduction to these topics for those people who face cancer and illness, their partners, and kind of anybody that has anything to do with it. So first, we'll just kind of briefly discuss what empowering intimacy is. I am a cancer survivor. I am a chronically chaotic medical disaster. I live with an ostomy that is a permanent part of my life. So I have kind of personal experience with a lot of the things that people are going through, all the different medications, the treatments, all of the side effects that can happen, and how that can really impact your life. And so that's kind of how I got started in this over 20 years ago now. And that is that this is an advocacy organization, and I get to focus solely on sexual wellness, sexual health, intimacy issues, and kind of helping people out of a rut, so to speak, to get back on the path that they're seeking in their life. And so we work with people one-on-one. We work with couples, and we work with lots and lots and lots of medical organizations to kind of be the middleman to provide these resources, whether it be digital resources or printed resources, so that these topics can really kind of come to light, especially right at the time of diagnosis, so that more people and patients have an idea of the things that they might be experiencing with their treatment and into survivorship with cancer. So that's kind of what we are. We have a website. There's tons and tons and tons of free information on there. There's different types of recorded interview sessions with lots of different medical professionals in all different kinds of fields, including mental health. And those are always there to watch at any time you might need. I am a sexual wellness expert educator. I've done it for a very long time. The things that I can bring to different organizations and people are kind of the out of the box things. So often our medical professionals are very well versed with prescription medication options for these issues or the surgical intervention options. But a lot of times they kind of skip over all those holistic options that you can do and kind of work with your own body to kind of rectify some of these issues. I mentioned the website and that there's lots of different things on there. And like Lauren said, she is recording this so you guys can revisit later. And I will send this slide presentation back over to her so she has this as well if you would like a copy to keep on hand for when you might need it. Contact information is here as well if anybody has any questions. I always say I'm just an email away. Please don't ever hesitate to email if you should need something. And with that, we'll kind of get right in. Section 1 is intimacy and body image. And these are together because they kind of play off of each other. And they're very important in the makeup of who we are as humans. So we start by defining intimacy. This is actually a question that I ask very frequently when we do in-person presentations, and that is, what is intimacy to you? And of course, people will shout out, that means sex. That means special time with my partner. And the best part about this is that intimacy can mean something different to everyone and still be correct. The dictionary defines intimacy as the innermost thoughts that a person has, the innermost feelings, the state of being intimate, warm, and friendly, close familiarity. And then there's lots of other words there that kind of go with that: affection, warmth, closeness. All of those different things kind of play into intimacy. And so you'll see some questions too as we go. You can see there at the bottom that they say they're journal prompts. I always love it when people kind of revisit these topics, especially if it's something that you are struggling with in your current situation. So consider writing these questions down and answering them for yourself at a later time or with your partner if you're looking for something to kind of get that conversation started and going. Those questions are, what do you think of when you first hear the word intimacy? And what does intimacy mean to you? to you just for yourself, and then to you within your relationships. Like I said, intimacy is a vital part of the human makeup. We crave intimacy. We need intimacy on a variety of levels to function, to have smooth relationships, to have those smooth connections, especially with ourselves. Self-love and self-connection is a huge part of being able to live life fully, grasp onto all those goals and dreams and future plans that you have, and keep going. It's also how we can be compassionate and empathetic with ourselves, kind of like we are with other people. And so often when we go through cancer and long-term medical chaos, we kind of disconnect from ourselves because we get so focused on just surviving, beating the fight, beating whatever we are up against, that we kind of put those other needs that we have on the back burner. And we have to work on not doing that so that we can reconnect with ourselves to come back to that whole path of living. And then, of course, intimacy is important in your relationships. Just my slide here. And it's not just the relationship in your marriage or with your partner or your spouse. It's also the relationships that you have with your children, with your family members, with your friends, your coworkers, with your pets, even those people at the grocery store that you run into and you can't quite get around them fast enough. We even have that with those people as well. And so without those intimate connections, relationships aren't as bonded or connected as those like relationships that we would consider best friends or our marital partner or our parents, things like that. And I keep talking about intimacy, I know, and sometimes people forget or don't know that there are over a dozen different types of intimacy in this world, in our lives. We hear about the top 5 that are listed on this slide here the most. So you see these in television shows, in newspapers, in your interactions that you have with people every day of your life. And then there are even more than this. So of course, we've talked about physical intimacy. And physical intimacy, like I've said, is often just thought of as sex. And that's just not true. Physical intimacy also encompasses some of the most basic human interactions, like hugging each other, holding hands, sitting next to each other closely on the couch, a gentle shoulder massage. All of those things also count as physical intimacy. And that's something too important to remember when you can't necessarily maybe have that sexual physical intimacy as you did before. And this allows you to still find ways to be connected in a physical sense. Experiential intimacy is a type of intimacy that gets built over time as you do things together, as you share experiences and kind of make those memories. Spiritual intimacy is often just kind of chalked up to the religious aspect of things, when really that encompasses your morals, your core values, your own personal beliefs. And it kind of all gets rolled into there in the spiritual aspect. Emotional intimacy is also a very important one. Emotional intimacy is built over time, again, in relationships where you see trust, you see people taking and making time for each other, sharing in those shared experiences, and again, building memories, doing nice things for each other. All of that helps to boost emotional intimacy. Intellectual intimacy is the intimacy we share when we are having those deep conversations or when we see something crazy on the news or on the internet and we need to talk that out with each other. That's sharing your smarts with each other, so to speak. On top of those 5 types of intimacy, there's also many more. Some of them I've listed at the bottom here. Work intimacy, that relationship you have with your coworkers, your creative intimacy, how your brain makes projects and helps you build things or crafts or things like that. Chaos and crisis intimacy, how you handle the rough stuff in life. And then my favorite is communication intimacy, how we interact, how we talk, how we communicate with each other. All of those types of intimacy are very, very important. And those types of intimacy then play into body image. Because when we are connected with ourselves, we often feel our best. When we are connected with ourselves, we can give and receive all those different types of intimacy with others. Problems kind of come in when we go through tough stuff. And of course, cancer is one of those tough things. The disconnect can happen with cancer patients and their bodies can create something called body dysmorphia, which is a body image issue or a negative outlook on our bodies. And it can happen because of the way our bodies look. It can happen because of the way our bodies feel to us, or just kind of a sense that things just aren't quite working right. There's a quote on the slide that says more than half of all cancer patients struggle with body image at some point in their cancer journey. And that's from the National Institutes of Health. Um, and I like to put that quote in there because so often when we work with people, we hear them say, I feel so alone. I feel like I don't know my body anymore. I feel like my body has let me down. I feel like somehow I'm just not up to par to human. And so we try to make sure that people realize that body image issues are one of the top issues that so many humans face, men and women alike, for so many reasons, illnesses, cancer, mental health, life situations, even natural changes in life with aging and menopause and hormone changes. So many things can create body image issues. And to work through those and to fix those is entirely possible, but it does take some practice and it does take some time. On this slide, you see at the bottom another journal prompt. How do you see your body image issues hindering your life? And again, that's going to be different answer, different question for everyone as body image affects us all differently. Body image also can be affected by how we think other people are seeing us and how they are judging us, even though it's probably not true. That's just those fun mind games that our brains play with us. So any type of situation or life change or medical event that changes the way you think about your body is triggering body image issues. And so we really have to work to change those negative thoughts into a more um, positive outlook so that we have a healthy overview of life. These body image issues affect us in different ways. So again, our self-view, which again is those body changes, the alterations that can happen to our bodies with surgical intervention, which is very common with cancer and cancer treatment. Those missing parts, sometimes if we have mastectomies, lumpectomies, if we've had to have certain parts removed, testes removed, all of that can kind of hinder your positive mental space and kind of twist it negative. There's a disconnect from the self, which again, once we have that disconnect, we're not accepting or giving intimacy. We're kind of walled off from everything. So we really need to work to kind of break those walls down. Those changes to our routines, our normal life as we knew it, changes our passions and the things that we can do, how we plan for the future. All of that can also play into body image. Relationships and connections, a huge part of body image and how we mentally process things. Once we tend to disconnect from ourselves and others, we tend to start not being as open in relationships. We might kind of not say when we're not feeling well. We might hold back if there's something that we need because maybe we don't want to feel burdensome or we don't want to be bothersome. And that can cause some troubles in maintaining those relationships. Daily productivity and planning can be hindered when we kind of have a negative outlook of ourselves, is that we just don't want to interact with people. We don't want to do as much as we were doing before because we just want to feel better. Then, of course, mental health, the worry, the anxiety, the heaviness, depression, the body dysmorphia with body image issues, self-isolation can trigger eating disorders, and all sorts of different things can kind of spiral from a negative body image outlook. And that's why it's so important to spend some time focused on that. These are some tips for kind of working on body image. And some of these tips might seem super easy, but we found that over the years of working with individuals, men and women alike, that sometimes people just don't know where to start because they're so overwhelmed with all that they have going on and all that they're trying to kind of trudge through, that these kind of things just kind of get put on the back burner because it's so overwhelming. So the list has basic things and some things that are, a little bit more involved. So the first is to work on understanding of your own needs. And again, that's part of that self-connection. Communication, what you need for emotional support, the physical support that you might need. The next is to educate yourself about all aspects of your cancer, your illness, your treatment, and your survivorship. The more you know about things, the more empowered and confident you will feel to be able to work through those and kind of see the light at the end of the tunnel. The next is to be aware of your internal self-talk and the thoughts that you allow yourself to have. And again, that's kind of, when those negative thoughts telling you that maybe you're not looking your best today, to kind of stop yourself in the middle of that thought, point it out that that's a negative thought and spin it differently. So maybe you don't look great today, but your t-shirt looks fabulous. Give yourself something positive to roll off of as well. The next is to try a new sensory experience or use a mindfulness app like Headspace or Calm, which can kind of help you learn deep breathing exercises. It can help you learn meditation exercises, and some of them even do some yoga with meditation, which is kind of cool too. The next is to take care of your body in a physical sense. So we're not just talking about working out and being active, but that's important too, but also dietary needs and your sleep schedules. Really take some time to focus on yourself in those areas. Seek support as you need it. Update your style and or wardrobe to stay active, even within your own home. A lot of times people we work with feel bad that they can't be up exercising or go to the gym or really get out of the house to do much. And we always remind that even being up walking around your own house counts as activity. So if you have pets, follow the pets around, if you have a dog, walk in the backyard just outside of your door. So you don't feel like you're so trapped inside of your walls that you're just stuck, but you're still doing things for your body and your mental health as well. The next, try intimacy activities that do not include intercourse. This is a very important one because, again, so often when people hear intimacy, they automatically go to sex and intercourse. And there's just so much in between those two things. So those intimate acts that you could try, cuddling on the couch, connecting via gentle massage, activities that keep all of your clothes on so that there's no pressure to feel like you have to do anything in a sexual nature at all. And the last area is important as well. Learn and hold your own boundaries. Boundaries are vital for relationships and vital for self-protection and self-connection. And then again, it comes with knowing yourself. So the more you get to know that yourself, what you want, what you need, and what you desire, and what you don't want, and you don't need, and you don't desire, the better those boundaries will be, and the easier you'll be able to put them in place. Self-care, I've mentioned a time or two here. Self-care, self-love, self-connection, all very in tune with each other. So self-care is how we take care of ourselves so that we can give or take care of others how we see fit. Because if we're not taking care of ourselves, typically we don't have all the extra energy to just go around doing things for other people that causes burnout. And then it can also make us sick or sicker or have more things to deal with our own medical chaos. So this is why it's important to take time out of your schedule, even if you have to schedule it in your planner just for yourself. It could be something that you love, getting your nails done, going and having a professional massage, taking a new adventure, going camping, finding a new woodworking project and jumping in the garage to do that. It's whatever brings you that passion and peace that you can spend time doing for you. There's a question at the bottom of the slide. How do you practice self-care? Sometimes people say, I actually don't practice self-care. And that's when I said, well, please let this be one thing that you take from this. Give yourself 5 minutes this week to do something just for you. Section 2, cancer treatment, side effects, and specifics. This section touches on how cancer treatment, specifically various treatments, can affect not just our physical bodies, also our mental health and our abilities, not just sexual abilities, but just even everyday abilities of the things we have energy to do and that we don't have energy to do. There are lots of different statistics on the National Institutes of Health's pages, or at least there were, that most all cancer treatment medications, and that includes chemotherapy, radiation, all the things in pill form, they all have the side effects that can cause sexual dysfunction, intimacy issues, and mental health issues. Of course, that's different for every person that takes them, how we react to medications. But this is why these topics and addressing them openly are so important. And these issues should be just as important as any other medical issue you had. If you had new body pain that wouldn't go away, if you have constant continued vomiting for some reason, all of those issues we take time to fix. And so often people put issues with intimacy and sexual function and dysfunction issues, they just kind of tuck it away. A, because it's not always easy to talk about. B, because sometimes doctors don't know the advice to give or where to direct patients to for resources. And C, because for some people, it's just very embarrassing to cover. And that's okay and that's normal. That's why I'm here to kind of break that ice and just put people into it. So again, with the journal prompts, here are what treatment side effects are most difficult for you, and how can you empower yourself to work through these side effects and issues that you're having. This is a list of the most common issues that cancer patients or people, women specifically on this list, are affected by that affect body image. And of course, these issues, because they kind of overlap into physical issues as well, also can cause sexual function and dysfunction issues. And you'll see that the lists for men and women are very similar because, truth be told, our bodies are very similar in how they are made up and how they react to these types of medications. So the first is incontinence, and that is essentially the loss of function of the bladder and bowels, loss of control, or both. Changes to vaginal lubrication, changes to vaginal tissues, the texture of how they feel, and the physical appearance of how they look. Painful intercourse and dyspareunia, which is vaginal pain that occurs with touch or insertion or penetration during sexual acts. And then there's vaginal atrophy, which is a very common problem for women in various stages of life, those going through cancer, those with progressive illnesses and diseases, and just the natural process of aging. Vaginal atrophy is the loss of elasticity of the vaginal, labial, vaginal canal, all of the tissues down there. And it causes everything to tighten up, kind of it shrivels and dries up, so to speak. The dryness can range. It can be mild or it can be extremely painful and severe. And it also causes a thinning of all of the tissues down there, which creates kind of a problem if you're doing things like sexual touch, any type of penetrative acts, even doing things like pelvic floor physical therapy, because the skin becomes so thin and fragile that any type of touch has the potential to cause a wound or a tear, which then can lead to bacteria, infections, all that kind of stuff. In addition to those, from radiation and chemotherapy or surgery, women can face low estrogen, early menopause, the loss of fertility and fertility issues, decreased libido, altered anatomy, and then mucosal alterations. And the mucosal alterations don't just reference moisture of the vagina. That actually encompasses all of our moisture producing tissues. So in our nose, in our mouth, in our eyes, in our organs internally, all of that can be affected as well. And it might seem like some of these things are very physically sided. But if you think about it, once we start dealing with these problems, it also hits us mentally because suddenly our body isn't working the way it should be. It's not able to do the things that it once was. And that can kind of be a downer and cause some of those negative thoughts to kind of come back in. So for women, if you are struggling with any of these types of things, you can consult your oncologist, your gynecologist, your patient navigator or nurse navigator, or a person like me, a sexual wellness expert. And the list for men, like I mentioned, it's very similar to that of women's. They also experience incontinence, bladder, bowel, or both, body pain, loss of libido and desire. And for men, changes to their normal sexual function. Normal sexual function for a man is the ability to get and maintain an erection that is hard enough and usable long enough for penetrative intercourse. Now, for men, when they can't get an erection, it's typically because one of the systems required for the body to function in that way is off. So for men, the vascular system, the neurological system, the hormonal systems, and the psychological systems all have to work together to make that erection happen and last. So you can see how if one of those things is off, that can kind of cause a snowball effect for other things to happen, which is called erectile dysfunction. Erectile dysfunction can happen at any time in a man's life. It can be an occasional event. It can be a partial loss where they can get what's called a semi-erection, or it can be a full loss of ability. When we experience erectile dysfunction, we also experience the thinning of the genital skin and tissues. And men can also have issues with ejaculation dysfunction, which happens when the ejaculate is too early in the sexual act. It is delayed and happens after the act is over, or it does not happen at all and it is absent or dry. Absent dry ejaculation is very common for cancer patients, and it is pretty commonly normal. It does not mean that anything is emergently wrong. There can also be changes to physical body characteristics, painful intercourse, and then, of course, due to chemotherapy, radiation, and surgeries, decreased libido, fertility issues, altered anatomy, and hormone fluctuations with testosterone surging and lacking at various times. For men who are struggling with these issues, your oncologist, your urologist, patient nurse navigator, or a person like me can kind of help get you back on track and find the resources that you might need. And then common chemotherapy side effects. And I won't go through everything that's on these slides. And as you know, the lists of chemotherapy side effects are endless and just ever flowing. Again, these are the most common things we've heard from people in all of our years of doing this and compiled here for that. The side effects that come from chemotherapy don't just hit one area of our body, as I mentioned when we started. It's kind of a full assault, a physical assault, a mental assault, an emotional assault. And having to deal with the side effect problems that arise as well brings on a whole new pile of problems. And so this is why we like to touch on these and get this information out there as well, that being on chemotherapy, regardless of the type, as there are many, can cause these types of problems. And it is very good to know and recognize them. Just a few of them, of course, nausea and vomiting, the high risk of infection, hair loss, extreme fatigue, the GI issues that seem endless sometimes, lots of different body pains that come and go, weight fluctuations. All of these different things can also play into our body image, the negative or positive side of things. It plays into our sexual abilities and how our bodies function, which is why it's so important to know and understand. Another aspect of chemo and radiation that is sometimes left out is the safe sex. So many people are unaware that if they or their partner are on chemotherapy or going through radiation, that they should be practicing safe sex while they are incurring the treatment, and then for a certain amount of time after it ends. Time after it ends kind of depends on your situation, where your cancer was located, where your treatment was focused, if you had radiation, and the type of medication you're on. Typically, the doctors that we have partnered with say 3 to 9 months, but again, that's up to you and your doctor, so something to ask about. What does safe sex mean? That means not sharing bodily fluids. The bodily fluids of a cancer patient who is going through these treatments have altered DNA and cellular compositions, which if your partner has a sensitivity to these drugs or treatments, passing that bodily fluid onto them can cause them rashes, irritations, all sorts of different things. And then, of course, there's always a chance of an unplanned pregnancy. And with altered DNA, that can cause some issues for fetal development. This is why it's super important to do. And this just simply means using things like condoms or dental dams, which is kind of a sheet, kind of looks like plastic wrap. So you could technically use plastic wrap to cover the genitals or cover the bodily fluids when you're practicing sexual acts or oral sex or different things like that. So that's what that means. And then the question at the bottom of that slide, were you ever made aware before now you should be practicing safe sex while undergoing treatment and after? We asked that question because we found out when we first started educating on all of this years ago that so many people hadn't ever been told this very important fact. That's just something that we throw out there. Common radiation side effects. The same thing for chemotherapy treatment. You know, all of these different things that radiation does to kill those cancer cells and help us survive also takes a real toll physically on our bodies in a variety of ways. And again, our mental health, which directly impacts our ability to be intimate, to want to be intimate, or to be sexual or do sexual acts at all. Of course, where the radiation is on your body will trigger different kinds of issues and side effects and things that you have to deal with. So those are kind of listed and broken down here. Again, not a comprehensive list. These are just the most common things. But those mouth problems, again, the nausea and vomiting, the fatigue, the GI issues, all of those types of things makes it hard to want to be intimate or sexual. So again, knowing that these things are possibilities and possible side effects and understanding how they affect you can help you work through those blocks to still accept different types of intimacy, maybe not sexual intercourse, but maybe those cuddling and holding hands and doing experiential experiences together, things like and then, of course, there's just standard medication side effects. We do a lot of these presentations for people who have progressive illnesses as well. And so they face a lot of the same types of side effects and body issues and mental health issues as cancer patients do. And all of these different things can really hinder our ability to feel attractive enough or self-connected enough to want to take the steps to be intimate. That's why we've added this into the presentation. Other common long-term issues that can happen during cancer treatment or even years after, and that's, of course, fertility issues, organ damage from the treatment, sexual dysfunction that has been classified as a permanent issue, menopause that is triggered, vision and hearing problems, joint pain, mouth ulcers, and mental anguish, just to name a few. All of those things are very important to address when they appear. Sometimes it's not so easy to admit to ourselves or others that we are struggling with some of these issues. And again, that's why we are here talking about them and trying to make it more streamlined so that these conversations can just be brought up normally, just like planning your grocery store trip. Okay, maybe not like grocery store, but you know what I mean. All right, section 3, we're going to jump into sexual dysfunction, holistic therapies, and some options to restore lost function. And this will be for men and women as well. So first, to define sexual dysfunction. Sexual dysfunction can happen for a variety of different reasons, natural reasons, aging, hormone fluctuations, but also with medical chaos, with cancer, with progressive diseases, because of medications, and not just chemo and radiation, but diabetes medications, mental health medications, heart disease medications. So many different types of medications can have these severe sexual side effects that can really set people back and kind of cause a disruption in their relationship. So the bottom line, like it says there in the middle, is to be open about the issues you're having, to give yourself time to heal and practice self-care, because again, sometimes that's a learned event that we have to really try for, and to give yourself space and grace to hit each step of life as you come back to find that path that you want to be back on. Some questions here. What sexual dysfunction side effects are the most difficult for you to live with? And are you aware that there are options for helping with these dysfunction issues that are not medicinal and not surgical in any way? This slide covers the most common types of dysfunction issues for female cancer folks and kind of the things that they can cause. So on the one side here, you'll see the reported types of sexual dysfunction. The first is low sexual desire. So a person who has low sexual desire has a lack of interest. They don't want to do it. They don't care about it. They don't want to make time for it. They just have no desire. Vaginal atrophy, which we just discussed, that can really hinder any type of intimate touch for women because it can be extremely painful. And when I say extremely painful, I don't mean necessarily like hands touching or different genital touching genital. Sometimes even just wearing underwear for some women is almost more than they can take when vaginal atrophy is really flaring. Then there's sexual arousal disorder. This is kind of an umbrella term. There's lots of other specific terms that fall under this umbrella, but this person desires sex and they want to be sexual, but their body just isn't working with them on this. Their body isn't becoming aroused. Their mind isn't necessarily falling in line, kind of turn the body on. So they face many different types of kind of roadblocks on getting over those humps to maintain and be able to experience and feel that pleasure. There's also orgasmic disorder. And this is a person that has trouble, not just one time, but kind of over a long period of time, has trouble feeling pleasure or even reaching orgasm. It's a condition called anorgasmia, when people cannot orgasm at all, and it's actually very common for both men and women. And then there are also sexual pain disorders. That's also an umbrella term with lots of specific conditions underneath. And that is a person that has pain with sexual stimulation or vaginal contact, or dyspareunia as well. Lots of different reasons for all those that can happen. There are also many more different things that can cause sexual dysfunction. These, again, are just the most common. But those things can trigger pelvic pain that comes and goes or that is constant, abdominal cramping, nausea and vomiting, insertion pain, and that's with anything inserted. That could even be for gynecologic exams when the doctor is inserting the speculum. Pain after orgasm, that's a very common one for women. Leaking urine or stool with intimate activities. Mental strain, anxiety, depression, feelings of unworthiness because they can't get their bodies to cooperate even if they want to. Relationship decline or disconnect. And being conditioned to believe that all intimate touch causes pain. And what that means is that when we are getting ready to be intimate and we're in action with our partner, and suddenly they touch us somewhere and it hurts. And it's not a little hurt, it's a hurt that's enough to kind of stop everything that's happening. Once that happens once or twice, our brains kind of grasp onto that and they remember that. And then every time that touch is almost going to happen, our brains kind of panic and they tell us, oh, hey, that hurt a lot last time. And that kind of puts up another roadblock and kind of preconditions our brains to get a little bit ahead of us sometimes, which is why we really have to take the time, again, to work on these issues as they arise. And these are the common types of sexual dysfunction for male cancer folks. And you'll see a few that are exactly the same on the women's list, the low sexual desire. And then erectile dysfunction, which we discussed, which means that they have most likely lost the ability to achieve or maintain their erection. Sexual arousal disorders, where again, the person desires sex and wants to have those activities with their partner and themselves, but their bodies just aren't responding. Orgasmic disorders. And then sexual pain disorders. Men can have the same types of sexual stimulation pain and the penis, penile shaft, and testicle area. Sometimes even towards the anal and rectal areas. It just kind of depends on where the cancer is and where their treatment might have been. And for men, the things that those cause, pelvic pain for them as well, penile pain, nausea and vomiting, pain after orgasm, leaking stool, mental strain, the relationship decline or disconnect. And then one interesting one that seems to hit males more than females is fearing intimacy. We've heard from a lot of men over the years that once they have lost their natural ability or kind of have to work very hard at reclaiming what they have left, they begin to kind of have a fear built up anytime intimacy is present, especially sexual intimacy, because they can't perform as they once did. So the fear of intimacy kind of opens up a whole new ball of wax, so to speak, with issues and sexual roadblocks that are there. So another thing to kind of watch out for. Self-discovery and accepting your body. So self-discovery is a form of self-care. Self-discovery is masturbation. I present in a lot of states, countries, and places that do not like the word masturbation. So I have to say self-discovery. So I kind of put them all together to make everybody happy. Masturbation is, of course, the touching of one's own genitals for pleasure, um, or with your partner if you're feeling fancy. It's a perfectly healthy way and an encouraged way to get to know your body again after surgery, or medical intervention in some way. It can help you learn new ways of going about doing things. It can let you know how your body is reactive and feeling to touch, to pleasure. A lot of times after we've had surgical intervention, our nerves are damaged. And so sometimes things felt really great before do not feel so great now. And so this type of self-discovery kind of gives you a map, or gives your partner a map to know where they can touch, where they can't touch, and just the things that you're looking for and need. But masturbation in itself has been proven to promote the release of endorphins, which are those happy, euphoric brain chemicals that get released. So it's all good. Promotes better relaxation and sleep, enhances self-esteem and body image, reduces stress and relieves tension, and again, helps you to get to know different areas of your body that are actually pleasure zones, because the genitals are not the only place that our bodies were designed to feel pleasure, to reach orgasm. So, my side note, I always like to touch on that. Side note, masturbation does not cause blindness, make you dirty, have hairy palms, infertility, sexual perversion, religious deviation, or reduced sexual pleasure. Holistic therapeutic devices. So there are tons and tons of devices on the market now that are created for kind of a restoration of lost function, for men and for women alike. The things that are listed here in the middle are what they cover. Kegel exercise therapy is for women. Men can also do it, but there's not devices for them yet. Dilator therapy for women. Internal massage therapy for women. Anal dilation therapy for both men and women. Breast and chest massage therapy for men and women. Erectile dysfunction pump therapy for men. And prostate massage therapy that also covers male health. And so one thing I will say about Empowering Intimacy, we do not sell any types of devices. We don't do any type of that. We just educate on them. So on our website, you'll find a whole section covering all these different products with links to places that you're very familiar with. Amazon, Walmart.com, Target.com, all of the different common places where you can find these types of things if you are so looking for them. So Kegel exercise therapy is done by men and women to help strengthen the pelvic floor. The pelvic floor are all the muscles that are in our hip bones. They go up the front of our abdomen, up our lower back, and down our inner thighs and outer thighs. They attach our hips, hold up our organs. They help us be able to use the restroom, urinate, and defecate regularly with control. And they also help with sexual feeling and pleasure. Men can practice these exercises by doing physical exercises, stretching, and even some yoga poses. There's lots of information on those on the interwebs, lots of pictures to show you exactly what you should be doing. Women can practice Kegels in the same way by doing exercise, or we have specially made devices called Kegel exercisers, vaginal weights, Kegel weights. There's all sorts of different names for them. But they serve the same purpose, and that's to also help strengthen those pelvic floor muscles. I always like to point out that some women with certain types of pelvic floor dysfunction, typically that's a high tone, so a woman that is always feeling like she's clenched and tight in the pelvic region, those type of women should not be practicing Kegel exercise without the direction of a pelvic floor physical therapist. For some women that have that issue, I was one of them, it can actually make it worse. So if you are thinking that you might have these problems, the person that you want to seek out is a physical therapist with a pelvic floor specialty. And that is something that we kind of help people link up with these different types of doctors all across the USA as well, if you are looking. In this slide, we get to put on our imagination hats. A lot of people aren't too sure where our Kegel muscles are. So the easiest way that I can get people to the same place quickly is to pretend like we're going to go to the bathroom, that we have to pee. So just pretend like you're sitting down and you start to pee, and then all of a sudden someone's knocking on your front door. And it's not a type of knock where they're just quick knock and they leave the package and they go. It's the type of knock where the person just keeps going and you have to stop the flow of urine to get up and go handle it. So those muscles that you use to stop peeing, those are your Kegel muscles. So as you're sitting here now, you can probably practice. No one will know, I promise. Well, I might, because I can tell by facial expressions, but that's okay. So you want to practice those muscles, and that's a Kegel exercise. So technically speaking, you don't need devices, you don't need anything fancy except for your body to work on these things. But for women, as you can see on the slide here, that row of pictures are all different examples of Kegel exercisers. So Kegel exercisers are weighted, so they're heavy. They're designed to be inserted into the vagina one at a time with a lubrication. We always have to be careful with our genital tissues. And you simply use those Kegel muscles that you use to start and stop the flow of urine to hold those in place. You do Kegel exercise therapy 3 to 5 times a week for 10 to 15 minutes a time. And that is how you slowly work those muscles and re-strengthen your pelvic floor muscles. So that's how those work. There's lots of different types of exercisers out there. We always say that if you're new to Kegel exercise, finding one that has a pull cord, most of these here either have a finger loop or a pull cord. This helps you to keep better control. And of course, as humans, when we have control over what we're doing, things tend to go better and our minds are much more at ease. So that's why that's important. So that's what Kegel exercise is. Next is dilator therapy. Dilator therapy has been around for a very long time. We found that dilator therapy is typically the most spoken about therapy of the holistic therapies with women as they go through different issues in life and through cancer treatment. Dilator therapy is done using a lubrication and a dilator. Typically, you start with the smallest size. Many doctors will say you start sizing by the size of your pinky, and then you move up through the months and through the therapy to the size that you need for comfort. Some women will go to a size that makes the gynecologic visit, the speculum, comfortable for them. Other women will size up to close to the size of their partner so that when they have penetrative intercourse, they don't have that pain. That's an entirely personal choice that you can make. Same kind of thing happens with dilators. You want to find a dilator that comes with a nice handle, that has a finger loop, that's easy to control and hold on to so that you can really get used to how this therapy works. Dilator therapy is much like Kegel therapy. It's done 3 to 5 times a week, typically for 15 to 20 minutes at a time. The dilator is taken, it's inserted into the vagina, and it's held in place. You don't have to use muscles for this one. You don't have to hold it tightly if you don't want to. This is just solely to help the tissues around the vagina become pliable again and be able to open up and be able to move more easily with your body. Dilator therapy for some women, you can do it for a few months till you kind of get back to where you need to be, and some women can stop at that time. For other women who have had surgical intervention in the genital area, radiation, or specific treatments in that area, sometimes they have to do dilator therapy on and off, essentially for the rest of their life, or however long they would like that comfort relief. So that's how that works. We have some tips on things on the slide here to look out for to be medical grade silicone or skin safe materials. That's very important, especially with dilators, especially if you have vaginal atrophy. So again, how I mentioned the tissues become very thin. So you want to make sure that you're using a dilator with material that can simply slide on your skin. That's not going to get caught. That's not going to cause those tears or wounds. A lot of times doctors will prescribe people glass dilators, which they do exist, or plastic. And those, because they're so hard, those kind of things can actually kind of catch the skin and cause those types of tears. So that's why using a lubrication is great and finding dilators made of the right materials, which is typically medical grade silicone. You want your dilators to be semi-flexible and firm because again, our vaginas aren't just one straight hollow tube that doesn't move. They move with us when we move and bend. So that's what you're looking for. A lot of times, all of the dilators that are out there now, you can use a water-based lubrication or a silicone-based lubrication. Talk about that in a moment too. And then sometimes there's options with dilators. Some of them offer vibration, and vibration is offered not always just for pleasure. Vibration helps our body muscles relax. So if you think about when we go to like the chiropractor and they'll tell us to use a wand on our back to, help break up the tension in our shoulders, that same type of theory plays out to every muscle in our body. And that vibration can just calm those muscles and calm the mind to relax. Another thing we've added in here is pelvic organ probes. So this can be very common when we've had treatment, radiation, and surgeries done in our pelvic region, especially for women, because our pelvic floor muscles can become so weak that our other organs inside our bladder and uterus specifically can almost begin to fall through the vagina. And in some cases it does. And some women can push that right back up there. And there's devices called pessaries that are made to help hold those organs back up. In some cases, people would need surgery for this condition. And in other cases, they can wear the pessary and then things like these belts that are shown on the slide to help kind of hold everything in place while you work through some physical therapy, kind of strengthen those muscles again. This is a very common thing that happens as well. Internal massage therapy. This would be for those women with vaginal tightness, with pain, with insertion pain, or deeper internal abdominal pain. So conditions like adenomyosis, endometriosis, uterine fibroids, adhesions and scar tissue in the area. These types of wands are made to be inserted deeply, and then gentle pressure is applied on those areas inside to help break up scar tissue or provide pain relief. These types of wands are fabulous. The yellow one specifically has saved my life numerous times. And it provides that pain relief in a safe way. There are wands, especially that yellow one, that is made to be either warmed up like a heating pad or it can be cooled like an ice pack. And so when you're experiencing that internal abdominal pain, being able to put that heating pad, right to where it hurts, or that cold pack right to where it hurts can be very, very beneficial. The person that would help you with your wands or with your dilators or with your Kegel exercisers are, again, a pelvic floor physical therapist. And typically they are very good at helping determine what sizes you would need for things, telling you which brands are the best, just all of that kind of stuff. Anal dilation therapy. It's done by men and women, and typically for those cancer patients who have had colorectal surgery, anal surgery, rectum surgery, or anything in that area, plus those with chronic pelvic floor issues, with strictures, which is kind of a tightening of the anal canal, with proctalgia fugax, which is sharp pains that come and go in the anus and lower rectum. All of those things often warrant a person practicing anal dilation. Anal dilation is done to kind of help open up those tissues and area again so that bowel movements can happen more consistently and less painfully. Anal dilators look very similar to the other dilators that we've seen, except they are much, much, much smaller. So it's not as overwhelming as it might look here on the screen. Anal dilators are used with a lubrication, just like the others, inserted into the anal area, left in place. You don't have to do anything special with them. Start with the smallest size and you move up to the size that's determined by your colorectal surgeon or yourself. Oops. Breast and chest massage therapy. We've touched on that a little bit. Breast and chest massage therapy devices are newer on the market. It's been about 8 to 9 years now since the first came out. There's all sorts of different types of these now that are out there. They are designed to fit across the chest, whether you still have breast and chest tissue or if it's been removed in a mastectomy. Still doable. It helps to relieve pain in the area, and it helps to draw blood to the area to help with healing. A lot of people report, and there's lots of reviews on the different websites with these, that the pain relief alone was very helpful for them. And then others reported that after months of use, they were able to feel some sensation around areas of scar tissue. So these can be beneficial if that's something that you're struggling with. We talked about self-discovery and masturbation earlier. So I like to touch on it just a little bit. So these are different tools, so to speak, that can help feel pleasure, that can help reduce the muscle tension. So it can help with that vibration, relaxation that I just talked about. And I posted pictures of these just because a lot of people in certain age groups and certain cultural backgrounds don't even know what they're supposed to be looking for when they want to find something like this. And a lot of people have these images in their head of very large sex toys kind of coming through. And yes, those sex toys exist and they're out there too, but we like to focus on the things that are here to heal bodies, restore that function, and let you feel different things, so to speak. So these are all very small. The first finger vibe is finger size, literally. A lot of times you don't need crazy, crazy powerful things. And the good news is a lot of these more normal, typical little vibrators and massagers are also available in condom section at your major retail stores. So you don't have to order crazy things on the internet sometimes. You can just kind of test out some small, easy, simple things to start with right there where you're comfortable shopping. And then same for men. These are masturbation devices focused for men. These are kind of varying levels. On the left-hand side of the screen, you have the most basic, which is just a sleeve that fits over the penis shaft, and then can be stroked and added for pleasure. In the center, you have a device that fits over the penis. It shows you inside all the different sensory feelings and textures that are in there. It creates the pleasurable feelings for him. And then on the far right, you have the fleshlight style, which kind of does the work for you. It's often battery operated or electric. They have preset features, so it kind of takes all the work out and lets people kind of get to know their bodies again. More examples of those for men because they have some very, very involved types of devices out there for them. The black device on here that you see, not only does it vibrate and have all of the little pleasure beads inside, but it also provides heat. So it's a warming device. And then you have the one that's on the bottom right that looks blue. That device actually has a motion that when the penis slides in, the device actually moves over the penis, much like it would be with real penetrative action. So lots of different devices out there for men and for women alike. Next, we're going to discuss vacuum pump therapy. This would be penis pump therapy for men. There are some precautions with this therapy, so I always like to touch base on these. This therapy is done to help strengthen the penile function, penile muscles, the shaft, and abdominal muscles. This can help with ability. This can help with men who have lost function to be able to achieve partial function. Typically speaking, when a man loses full function, especially due to cancer treatment or heavy medications, that function is not going to come back at 100% ever. It's unfortunate but true. With that said, there are lots and lots of things that can be done to make sure that that man can still have those penetrative acts, can still be sexually intimate with their partners and themselves. Lots of ways to work around it. Who should not use a vacuum pump without checking in with their doctor? And again, this doesn't mean that they can't use it. This just means that they should check in before diving in, just as an added level of safety. Those patients would be those guys on blood thinners or blood pressure medications, those with priapism, which is an erection that kind of never goes away, that you kind of have to go get hospital emergent treatment for. They used to have lots of commercials on TV for it. Those with sickle cell anemia, those with blood clotting disorders, or those with heart disorders or disease. And again, it's just a check-in with your doctor. It doesn't mean you can't use them. Typically speaking, vacuum pumps are very safe. One of the things that they can do that can cause some issue and worry for men, if they didn't read the directions, is that they can cause what looks like hickeys on the penile shaft. And that happens because sometimes when they put pumps on, they either A, don't read the directions, or they don't have a tight seal, or they're a little off on their pressure. Because with these pumps, which I'll show you here, they look like, the user controls the pressure. So until a man kind of gets used to how his pump works and the pressure that he should be aiming for, something like that could happen. It's not an emergent issue. It can be kind of frightening to look down and see a hickey on the side of your penis. But again, it's not emergent. But that's why it's best that we learn about our pumps, read those directions, and follow them as close as we can. This slide here shows a variety of air pressure pumps. So these pumps from the left side of the screen to the right go from very basic all the way over to a rechargeable, battery operated, kind of does it all for you pump. Pumps work by the pressure that builds inside of them. So a man uses lubrication on his penis and penile shaft all the way to his body. The pump is goes over the penis all the way to the body. The man then uses the pump to reach his desired pressure. The nice thing about penis pumps is the cylinders are see-through. So the user can see exactly what's happening real time. So he can stop when he needs to stop, keep going if he needs to keep going. There are emergency pressure release valves on all of the pumps. So should there be a problem, you hit one button and everything is done and it can come completely off. When the pressure is reached or the desired size, they've reached their desired size, the pump part slides off, but that little black ring that you see at the bottom of pumps, that stays at the base of the penis at the body, and that helps to hold the blood that you've just pulled into the shaft. That helps hold it in, thusly create an erection. So again, these are air pumps. They just use air. And there's also water pumps. Water pumps are a little bit newer. I believe these came out about 6 years ago. They use warm water or air, so these are kind of versatile. For many cancer patients, these have been the answer because it provides a very gentle action on the genitals, especially fragile genitals. The only thing with water pumps is that they are very size specific. So the boxes will say that if your penis erect is between 5 and 7 inches, this is your model. Same for larger sizes, same for smaller sizes. So it's very imperative that with water pumps, you be honest with yourself when buying them so that you get the right size pump that will work best with your body. Prostate massage and stimulation therapy is done to help drain the prostate gland built up toxins. Those toxins have been proven to be linked to prostate cancer. And so it's best to practice that therapy or to regularly have ejaculation sessions, if you will, to clear it out. Now, for those men who have had a prostatectomy and no longer have a prostate massage is also great to help break up the scar tissue in the area where the prostate was, helps reduce pain. And for some men who have lost erection function and they cannot get an erection anymore, prostate massage and stimulation provides those pleasurable feelings and can help them to orgasm and have that release. So kind of a different option there. And you see the different tools, pictures of the different types of tools. These are small probes. These are very small, much like the anal dilators were, teeny tiny finger size. Some of them vibrate, some of them don't. Again, that's a personal decision. Typically speaking, integrative doctors and urology specialists are most known for helping with these types of therapies. I do know a few physical therapists that have instructed people on them as well. So if you have questions about this, don't shy away from asking. But that's explanation there. These are some other common erectile dysfunction device support options. On the left side of the screen, you have different types of enhancement rings, support rings, or some places call them cock rings. These help to hold the blood into the penis shaft, thusly creating an erection or helping that erection last longer. On the right side, you have wearable devices. These devices are for men who have lost erection function completely and still want to have that penetrative sex connection with their partner. So these devices are slid on over a flaccid penis using lubrication. And then worn. Some of them have straps, some of them have testicle straps. The top has the black straps that would go around the waist. The bottom, is you can see there, has kind of a loop at the bottom, and that actually goes over the testicles, and that's how it is held in place. Both of these items warm to body temperature. Their skin soft, so it just kind of warms to your body temperature and kind of feels like an extended body part. But those devices are very helpful for men who have lost function to keep up with the act of sex with their partner. They're available in all types of body colors, skin colors as well. And then, of course, there's lots and lots of information on site about the various types of breast prosthesis forms, whether sticky, permanent, fit and bra, just the nipple forms that can go onto skin or onto other forms. Lots of info on that for those who aren't sure if they're having reconstruction after mastectomy or whatever. And then as we get ready to wrap up here, this is one of the biggest topics that I cover all the time, so it has its own section. The question says, do you know the difference between water-based lubrication and silicone or silicone hybrid lubrication? There's a lot of choices out there in the lubrication world, so I'd like to touch on them just a little. These are examples of water-based lubrications. Water-based lubrications are thin, it's a thin liquid, so it provides a thin friction barrier and limited use time. With water-based lubrications, and you might have experienced this already, you usually have to reapply them often. And in situations like showers or pools or bathtubs, they don't last at all. Our bodies are made of water, so anything that's water-based that we put on our skin just gets absorbed right in. So it's not as long lasting. But some of these brands, as I said before, are available at your local major grocer in the tampon condom section. So you don't have to go far for lubrication. Astroglide and KY Jelly have been around for a very long time. System Joe, Liquid, those are some of the top brands out there and that are also the most natural. These are examples of silicone lubrication. Silicone lubrication or silicone hybrid lubrication is different from water-based. It's made to be a little bit more sensitive for those people who struggle with sensitive skin or for cancer patients who are struggling with really thin, fragile genital skin. Silicone lubrication is thick. It's a long-lasting friction barrier, and it doesn't absorb into our bodies like water-based does because it's not made of water. So you don't have to reapply it as often, and it will really protect your fragile skin. And again, lots of the same brands that I just mentioned. KY has a silicone brand, Astroglide, all of them have a silicone option as well. Specialty lubrication with a purpose. Some specialty lubrications can be very beneficial, especially those that are made for the anal region, especially for anal dilation or prostate massage. Anal lubrications have a desensitizer in them that takes the initial pressure, pain, and stinging out of anal insertion. So whether that be just dilators that you're using after surgery or whether you're participating in anal sexual acts, these types of lubrications can desensitize you just enough to kind of take the edge off. It does not numb everything. It does not numb internally, so you can still feel things. It just takes the edge off. Specialty lubrication. So like my first little sentence says there, some lubrications are made for sales. It's made for, ooh, wow, look at that. That's pretty. And those types of lubrications, typically you just want to stay away from. These types of lubrications have so many additives to get the colors, to get the flavors, to get the little fancy things and glitter that they have in them. It's just too extra. Flavored lubes are riddled with sugar. Sugar in the vagina equates to a yeast infection or BV, bacterial vaginosis. And so, of course, when we're already dealing with all sorts of body issues from cancer and illness, we don't need to add more. The lubrications that offer things like cooling sensation, warming, or tingling sensation, those also have additives in them, most of which are listed as skin irritants. So for people who have very sensitive skin, these are just kind of a disaster and a half. So I always say use caution. And if you are using these lubrications, test them on a very small area of your genitals before jumping into the whole thing. We've dealt with people in the past who have used these and ended up with essentially skin burns from some of the additives. And in the genital area, that's just not pleasant to deal with. Moisturizers. Daily moisturizers for female or for men who have very dry, flaky penile skin can be super, super helpful and ease that discomfort. With vaginal atrophy and the severe pain that comes along with that dryness, these types of balms shown here are fantastic. These are actually my top 4 fantastic. So they're made to be super thick, super long lasting, Most of them are all natural. So they use things like apricot oil. Olive and bee uses beeswax and honey. So very natural, helps moisturize those tissues very gently so that you don't have added issues and more. These are also fantastic to use for the changes that occur just with natural aging and menopause. These are all available on Amazon in various parts. And again, there's lots of info on our website about them as well. Device cleaners, and this counts for all of the things we've talked about: Kegel exercisers, dilators, penis pumps, um, tiny vibrators, the wands, all of the things need to be properly cleaned, more so than just using your Dawn dish soap. They do make lots of different cleaners. Again, lots of them are available in your major grocery retailers, and these are designed to get into that medical grade silicone and into those teeny tiny microscopic pores where that bacteria sits to really clean them out. And that's really important. Another statistic was over 80% of vaginal infections came from dirty parts, dirty hands, or dirty sexual devices. So that's something that we're very big on too, is just take care of your body and keep those things clean. All right. Are there any questions on those holistic therapies, devices, or lubrications that we just discussed? I'm going to scroll through my last slides here. Insurance coverage. So there is insurance coverage, possibility anyway, for any of these devices that we just talked about, especially with the cancer diagnosis. If you have a prescription from your doctor for them, you can verify with your insurance company, because obviously every insurance company is very different. And if they do have that coverage, typically you just need your receipt from purchase with the appropriate L code, the prescription from the doctor, and the reimbursement paperwork from your insurance company. And you can get some or all of your money back from some of these items. Some people don't know that. Again, we don't sell products, but we do help people make sure that they are looking for the right type of product, and then we can get the A codes and L codes as well. Not all sex devices or sex toys have the possibility to be covered. It's really only the more medical grade equipment that is covered.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.